Joining us now, Republican Congressman from Georgia, Representative Tom Price. Going to defend Congress. Good luck.
Good luck.
Dr. Tom Price.
He's one of the 9%.
Of the House Republican Policy Committee and member of the House Ways and Means Committee and Budget Committees. And joining the table as well, former Democratic Congresswoman from California, now president of the Woodrow Wilson International Center for Scholars, Jane Harman. Thanks to have you.
Well, Congressman, let's start with you. We've been kicking the tar out of your institution.
Yeah.
Nothing's getting. A well-deserved 9% approval rating nationally.
It's the Seinfeld campaign.
Happening. What's happening? What's happening?
Well, in the area of health care, right now, everybody's on hold. We're just waiting for the Supreme Court to rule. And in the legislative branch, we're waiting. In the executive branch, they're churning out the rules as rapidly as they can. And at the Supreme Court, I think the decision's been written, and it'll come down this week. So.
But nothing seems to get done in Washington. You guys pass bills. It goes over to the Senate. Harry reads the pocket veto. The president's not even vetoing bills. Nothing is happening.
Well, it's because nothing's getting through. The challenge that we have, and sadly, is that the president seems to have said that Congress can't get anything done. So if Congress gets something done, then it really harms his narrative. And so my sense is that they don't want anything to get done, which is really a shame, because the House has passed in a bipartisan way, frankly, so many pieces of legislation, whether it's appropriations bills or whether it's bills to get this economy rolling again, and they sit over on Senator Reid's desk.
But then again, Senator Reid would say that they're too conservative. They're out of the mainstream, and the president would never sign them anyway.
And the big stuff isn't getting done. Simpson Bowles is the right template. I've heard you both talk about this forever. For economic reform, there ought to be some form of infrastructure bank for short-term build-out of transportation. If health care goes down, and I'm not going to defend it as a perfect bill, although I voted for it, if it goes down, Congress needs to do something, but that won't happen. Tom and I were just
and that'll be more of nothing getting done, a big unraveling of one of the biggest things that was done.
But think about what our process is, Joe. I mean, if the House passes something, if the Senate doesn't agree with it, then it ought to pass something at least, and then we can go to conference and
there ought to be conferences.
Absolutely.
The leadership goes around the conferences.
But yeah, again, that's what usually happens. If you remember, I'm just a bill. Yes, I'm only a bill. Well, the way it happens, the House passes something, the Senate passes something, they disagree, they go to conference. Sure. They figure out the differences.
It actually works.
And then you go to the president. What has happened over the past several years is the House passes something and the Senate sits on it.
Yeah.
Now, the Senate hasn't even passed a budget, Jane, and we talk about this all the time. And by the way, the Senate has a guy I love, a great budget chairman. Even he's frustrated. He made the announcement, I'm going to pass a bill. They took him inside of a meeting, beat the heck out of him, and he came out and said, okay, so we're not going to pass a budget after all.
It's tragic. And people are still trying in the Senate.
What's happening over there?
In the Senate?
Yeah, I know that's not your...
Well, but there are meetings of key senators. We were talking about Saxby Chambliss. There's Mark Udall. There's Mark Warner, all of whom are very interested in going big.
Right.
The template's been on the table for 2 years. I wrote an op-ed with Vin Weber last summer saying it was a big mistake not to introduce it after the commission that Obama formed reported, but nonetheless there have been times all along the way to introduce it. Nothing has happened.
And Jeffrey, when you have everybody from Tom Coburn to Dick Durbin, two guys who are as ideologically apart as possible, saying we need to do something, and they actually locked arms together at a political risk to themselves. And then the president sat back and said, I'm not going to touch that. There's a problem.
Yeah, well, we've been stuck on the basic budget issues for years, and there is no compromise. The compromise is more taxes and cuts in spending, and we can't get that basic compromise. So what are we doing? We're at the lowest level of tax collections as a share of national income that we've been in decades. The budget continues to hemorrhage. You can't solve this just by cutting. No. What's going to happen, Congress?
Well, the fact of the matter is that the last thing that anybody needs or wants is higher taxes to chase ever-increasing spending. So you got to get spending under control, and then you got to grow the economy. And when you grow the economy, in fact, the revenue increases. Now, we're not opposed to changes in the tax system. In fact, we've proposed through our budget a significant reform of the tax system that would close those loopholes that everybody is concerned about, that would broaden the base, lower the rates. What that does is actually reinvigorate the economy, and we can get back to the average percent of
you do
revenue.
Understand, though, a grand bargain.
Sure.
That comes forward. By the way, I was, I had like a 95% ACU conservative rating. Jeffrey Sachs is scared to even be seen in the streets with me because I'm so conservative ideologically. Yeah. But you and I both know if a grand bargain comes that's going to save Social Security, that's going to save Medicare, that's going to save Medicaid for the next generation, that's going to make tough choices on national defense, we're going to have a tax reform bill that is going to bring in more revenue
as a share of national income.
More revenue to the federal government, and not just through the sort of means that we talk about, like growing the economy.
Listen,
that may be, but that may be.
You're open to that.
But the process is that the House passes something, the Senate passes something, and then let's get together and work on what the solution is. What has happened is that the Senate has absolutely stalled,
but the process is broken, and the blame game is the paradigm. Each side blames the other for not solving the problem, and they don't want to solve the problem because it works better politically not to solve the problem. I voted for the '93 Clinton budget, which was the one that was Democrats only. I almost lost in '94. I won by 800 votes. That set up, I've heard you say this, Joe, a few other changes which were bipartisan, and then came this fabulous vote in 1997 for a balanced budget. And then came 5 years of prosperity. That's a movie I'd like to see again. But we have to be brave to do it.
In 1993, and this is what happens. In 1993, you guys pass a tax increase, which of course I went around calling the largest tax increase in the history of mankind. It was going to kill the world. It got people like me elected, right? 2 years later, we enacted some really tough spending cuts.
Which I was for.
Which you were actually for. But every other Democrat was comparing us to Bull Connor and saying we wanted to throw grandma out in the street and wanted to kill babies and eat their limbs.
Those were the good old days.
Penny Kasich, remember that?
Right,
even
Penny Kasich.
Republicans and Democrats.
Think about that.
Cut $100 billion.
Those two, what was done in '93, what was done in '95, the deal that was done with Bush in 1990, it all added up to explosive economic growth over a decade.
And a huge bipartisan vote for a balanced budget in '97.
You're right. But it's not just the budget. It's every single issue that we could highlight in this manner. Healthcare is a classic example. With the bill that was passed 2 years ago plus, was simply a one-sided bill. This isn't the way to govern this.
Okay, so Doc, you're a doctor. Answer this question. Why does the United States of America spend more money per patient, per person, than any country on the planet, and yet we don't get the best results?
Well, it's a complex answer. One, we do get oftentimes the very best results. If you look at the top 5 cancers in the world, we have the highest quality results. We also count more money. If you go down to the drugstore this afternoon and buy a Band-Aid, that counts for health care expenditures in this country, whereas it doesn't in other nations. Now, that's not to say that the system is as it should be, because the status quo is absolutely unacceptable. Doesn't work for patients, and it certainly doesn't work for physicians in this land. That doesn't mean that you have to put the government in charge. It doesn't mean you have to put Washington in charge. There are wonderful solutions that don't put Washington in charge of your health care.
There were a lot of good solutions on the table that we didn't take in health care reform, which I did support. I come from a family of medical doctors. Joe Klein, who is truly wonderful, wrote this piece in Time magazine.
Spend much time with him, but go ahead.
2 weeks ago, called How We Die, which made a very valid point. And for those of us who've lost our parents, we know that how we die can make a big difference if we intervene in the last days of life. And it would save our country. We as a family. But also if we have appropriate medical help that understands and advises on how things could be better.
And I don't know, Doctor, how the system has changed, but I talked about how Cleveland Clinic does it.
Yeah.
And they reward their doctors based on results. They don't reward their doctors based on giving tests. Right now we have a system that rewards doctors, that rewards hospitals, that rewards medical providers by performing tests that bring more money into the bottom line. They all get richer, and that's how they grow new wings. The Cleveland Clinic does it the right way.
Well, it certainly does it the right way for the Cleveland Clinic. Now, the problem is that if you look at the Cleveland Clinic and you say...
hold on a second. I got to stop you there. No, as a small government conservative that believes in the market, we're always talking about results. This should be about results. If a teacher is terrible, get them out. If a teacher is good, give them a raise. Why don't we do the same thing with doctors?
It's not a government program. That was Joe's point.
If a doctor gets a good result, give him a raise. If he gives a test, it doesn't make me any better. I don't care if I have 12 MRIs.
My point is,
if I still can't walk, Why is that hospital making all that money?
My point is that what's right for the Cleveland Clinic isn't necessarily right for Atlanta, Georgia, or for Appleton, Wisconsin. I visited Theta Care up in Appleton, Wisconsin a couple months ago. John Toussaint, the physician in charge of that, has changed the dynamic there in a way that is rewarding results, making it so the highest quality of care can be delivered. It's a different model than the Cleveland Clinic, but it's working for Appleton and Green Bay. And that's what we ought to be doing, is allowing physicians and communities to be able to have the kind of system
our
that
problem
works for
is
them.
we don't have 30 years to have this organically pass. Medicaid is going bankrupt. Medicare is going bankrupt. We're going to have to figure out.
But there are models
how to
out there that
scale
work.
this.
There are models out there that
Let's
work.
find those models and scale
And
them.
then
from
let's
Washington.
pass them in the House and the Senate rather than just fight.
Congressman
gotta
Tom
go.
Price and former
Thank you,
Congressman
guys.
Jane Harman. Thank you so
He
much.
just moved Congress's approval rating up to 9.5%.
Yeah.
You are now
It'll hold
Got you,
for about
Hunter.
5 minutes.
Not so fast.
Sorry, it's so hard. Still ahead, we'll talk to former State Department official Anne Marie Slaughter about her revealing new article examining the